result of the wear and tear that occurs in this joint from
Okay.
so many other risk factors that will now necessitate them coming down with the disease condition.
Okay.
Typically, it's just like two metals or two substances grinding on each other. You need that grease. The grease meaning the synovial fluid as well as the cartilage to help, in the movement of that joint. Once
Mm.
those materials in quotes are off, you now see like bone grinding on each other,
Okay.
which will culminate in the signs and symptoms or the symptomatology that patients usually present with, which is usually pain,
Mm.
stiffness, and
Yeah.
deformity and all that.
I know that. Okay, so now is that the reason I see, because there are cases where I've seen people tying their knee with cloth or something, like there's a bandage, they tie the knee. So is that usually a case, is it a case of osteoarthritis?
For osteoarthritis, I think we should start from what does the knee do first. The knee itself is like support system comprises of the knee joint, which comprises of the femur, the shin bone, the femur meaning the thigh bone, the shin bone meaning the tibia and the fibula, and as well as the patella. And in between them, there are other things: the cartilage, the ligaments,
Okay.
medial and lateral collateral ligament that helps in stability of the joint, as well as the cartilage, the meniscus in between the ends of the shin bone and the thigh bone.
Yeah.
It is the once the cartilage is off from wear and tear,
Okay.
the ends of the shin bone as well as the thigh bone continues to grind on each other,
Mm.
resulting in that pain that patient comes with, resulting in inflammation that will result in pain, the joint stiffness, the early morning stiffness, and when worst case scenario, it will
Yeah.
now result in deformity, which can be inward bowing of the knee or outward bowing of the knee,
Okay.
which we call genu varum or genu valgum, that will
Oh,
ultimately cause patients
clubfoot.
some kind of distress and will need possible intervention.
Oh,
So
okay. Yeah.
the going to also is it's also important to understand that there are risk factors.
Yeah, I was going to ask you about the risk factors, the causes of it, even. But you said, okay, that's what causes cases where you see the club foot. That's the foot turning in upside down and the bow leg.
The pathology, we are talking osteoarthritis, the pathology is on the knee. Obviously, yes, once your knee is turning inwards, the foot too tends to adopt a kind of position known. However, there are some risk factors, co-founders that have said that are modifiable or non-modifiable wounds. Age is an example of a non-modifiable. As we age, there is wear and tear of those joints, not
Okay.
only the knee, but because the knee, which is also serves as a weight-bearing joint,
Mm.
uh, would uh, possibly result in that osteoarthritis.
Okay.
Also, some other factors such as being females, because of the withdrawal of estrogen. Estrogen is important in calcium um,
Okay.
metabolism. However, once you are attained menopause, estrogen is being withdrawn, there is reduced calcium
So
and
you're
all that.
saying that
That
there's a
would
possibility my leg will likely bend? If you're saying it applies to females, is there a possibility that.
females than in males. In essence, basically, that's what I'm trying to say. Mm.
Okay.
And females usually postmenopausal. And also, of course, if you are obese or overweight, the knee serves as a weight bearing joint.
Okay.
The knee might not be able to carry
The
that weight.
weight.
It will
Okay.
result in the damage to that cartilage that will subsequently result in wear and tear, which
Of
will culminate in the symptomatology of osteoarthritis.
okay.
Also, other factors that can result, risk factors would also include, if perhaps if you had a injury to the knee
Mm-hmm.
prior to uh,
We
old
can hear
age.
you.
If you have
Yeah.
had injuries, they call it post-traumatic osteoarthritis. And in such kind of patients, they tend to have osteoarthritis early. You have
Mm.
had injury, you have had a fracture, that's fracture of the shin bone or the thigh bone that
Mm.
has gone, that is intra-articular, that means within the joint. You
Mm.
are at risk of having osteoarthritis later on in the future. If you are an athlete or you have that propensity to repetitive use of your knee, as seen in athletes, basketballers, footballers, there is
Yeah.
also a high risk of you
Mm.
coming down with osteoarthritis, which is usually earlier than envisaged.
Okay.
And also some genetic factors that can result in you coming down with osteoarthritis too.
Osteoarthritis. All right. So, is there a chance that prolonged sitting can also cause the osteoarthritis?
Not cause osteoarthritis because you are not bearing weight on your knee.
Okay.
Once you are bearing weight on your knee, uh, that is where it would result. And as part of the regimen and managing it would also be the role of physiotherapy, weight reduction, especially for those that are morbidly obese or have that are overweight.
Okay.
This is in a way in trying to shed off load
Mm.
away from the knee, and that will help you prevent pain that comes
Okay.
with osteoarthritis.
Okay, so not to deviate, but I'll just use this chance to ask you a question. So, what could be the reason where you lie down for a long period of time and then you sit, or you sit down for a long period of time and then suddenly you try to get up, but then you feel that your knee uh, cannot function properly? There's a lot of pain on your knee, and it goes on for days.
Well, that might have been a internal derangement in the knee, but not necessarily osteoarthritis. Also, for osteoarthritis, they have a typical presentation. Usually, it comes pain, usually dull leaking around the knee. Usually around the knee, not it doesn't radiate. Dull
Yeah.
leaking might be deep seated. Usually worse with activity. Mm.
Mm-hmm.
Usually worse with activity, meaning when the use of the knee joints, and it will be temporarily relieved when you rest the knee, analgesics. Mm. But
Okay.
subsequently, as it goes worse, even at night, you might still have that pain. Then they usually come down with early morning stiffness. Mm. Early morning stiffness, when you wake up at night, early morning, you want to stand up, you feel that stiffness. But as the day goes by, once you start moving the knee, the symptoms subside.
Okay.
Mm.
Okay.
Also, you might be having recurrent swelling. You just see the knee get swollen.
Okay. So you're
Subsequently,
talking about the
afterwards,
symptoms now.
I didn't get that man.
I said you're talking about the symptoms of osteoarthritis now, right?
The
Okay.
symptoms are chronically the symptoms, the natural history of how osteoarthritis of the knee comes by.
Okay.
And also, subsequently, you will observe that patient comes down with what looks like the deformity. The way they walk, you see, as if it is like a key leg or a
The
bow
bull
leg,
leg. Yeah.
depending on which the patient would finally have. Then patient might also complain of knee instability, as if the knee wants to give way while walking, because the collateral ligaments now are becoming more lax.
Hmm.
Also, when they examine the patient, patient will feel as if there is a gritty sensation. They call it crepitus, as
Hmm.
if there is something in the knee that is grinding, in quotes, the knee.
Hmm.
They call it, we call it crepitus.
Okay.
And
Okay.
uh, basically, over time, patient might want to adopt using a walking stick as a form of temporary relief,
Yeah. To support.
and subsequently, even
Hmm.
the walking stick might not even do the job,
Okay.
such that even if you give analgesia or pain relief, it will not solve the issue.
It won't solve it.
That is where you step it up a notch
Hmm.
as regards the management of this patient.
Okay.
Here, you
So
might now want
yeah.
to put counsel the patient for more in-depth intervention, which will be in form of surgical intervention.
Hmm. Okay. Now, what is the cause of this in children? Why do children sometimes come out with this condition?
Rarely would you have osteoarthritis in children. Rarely. Mm. However, for children that, well, I was not really children, but adolescents that will come down with osteoarthritis or early osteoarthritis would have been as a result of conditions that would cause either bow leg or key leg. We call it genovarum or wagon that are not properly managed. That are not properly managed. The likes of rickets can cause key leg. When you have what we call a blount disease that have been neglected, can result in early osteoarthritis in adults and not necessarily children.
Okay.
We have developmental dysplasias of around the knee area can also result in osteoarthritis. Yes.
Okay, but later on the program, I would also want to get your thoughts on why some children come out with the bow leg situation. But let's focus on the osteoarthritis now. You talked about the symptoms. Are there also fever symptoms, or what of weather conditions? Do this contribute as well? Let's say during the cold weather, do you have this situation as an external risk factor?
Well, it's not in the books. Most of our lay people will say the weather. Once I have this cold, I usually have this.
Yeah,
it's not in the books. There's nothing of such.
Okay. All right, then. This is Spotlight. We're looking at osteoarthritis. Arthritis on the program right now. We have an orthopedic surgeon, and if you have questions as regards knee discomfort or bone diseases related questions, we have Dr. Isido Charles Kolawole in the studio with us. Not in the studio, but online with us. So ask your questions, call in, and he will guide you accordingly. All right, 0805 092 0927. That's 0805 092 0927 or 0705 890 4927. That's 0705 890 4927. You can send a WhatsApp or WhatsApp message to 0705 690 0927. All right. So what are some of the how common is it? Is it common with men or more, or with women more?
Yes, ma. Thank you, ma. In my previous deposition, I said it is more common in females. And females of postmenopausal age because of hormonal issues. Withdrawal of estrogen would cause depletion of calcium, or calcium metabolism is distorted. That might possibly result in patient coming down with osteoarthritis. Common in females, and usually females are usually more obese, overweight. Those are peculiar risk factors.
Okay, so how about diets? Are there certain diets that exposes one to risks of having this in the long term? Lifestyle that can contribute to it?
Yes. Also noteworthy is also chronic alcoholism as well as cigarette smoking.
Okay.
Those are just co-founders to cause osteoarthritis later on in the future.
Okay, so how prevalent is it in your practice? How often?
Apologies. Also take note that for gouty arthritis, which is not osteoarthritis, please take note. The taking of excessive consumption of red meat has been known to be associated with causation of gouty arthritis.
Okay, that's too much intake of red meat.
Sorry, ma. Beg your pardon.
You said too much intake of red meat causes it as well.
Can cause gouty arthritis, not osteoarthritis.
Okay. All right. So I was asking, I said, how prevalent is this condition in your practice? How often do you get to see this happen at the teaching hospital?
Okay. Yeah. Thank you. It's so common that in the hospital we actually have a clinic for, they call it arthroplasty clinic, where patient comes
Okay.
for care. Basically, they come with pain, usually pain of the knee joint as well as the hip joint,
Mm-hmm.
that will ultimately result in them wanting to have a surgical intervention. But
Mm-hmm.
however, we should also take note that you don't just go and fix a knee
Okay.
or a joint that is arthritic. You must have been seen to have adopted other non
Mm-hmm.
surgical management to this.
Okay.
The only indication would be when you have pain that is not responsive to your medical management and is affecting the activity of daily living of the individual. The activity of daily living of an individual will include things that you do basically mm,
Mm. Mm.
daily.
Okay.
Taking care of yourself, you are not able to do that. For the Muslims, those that cannot need to pray and do their daily five daily prayers,
Mm.
and you are already having such impediment, that is telling you that you need to,
Yeah.
now do surgical intervention.
Okay. So now, how is this condition diagnosed? We've talked about the causes. We've talked about the risk factors. How is this diagnosed? Okay, hold on. We have this call here. Hello. Good morning.
Good morning.
Hi. Good morning.
Good morning.
Okay. Can you hear me? All right, so please try to call back. The number is 0805 092 0927. That's 0805 092 0927. If you have questions for the orthopedic surgeon, that is bone doctor. I believe that's what your orthopedic, that's a bone doctor, right? Bone specialist.
Yes, basically, yes, ma'am.
Okay. All right then. So talk about bone diseases and some of this bone situation. We see bone conditions. So if you have questions, you can call the studio line. You can also call 0705 890 4927. All right, on Spotlight right here. So I was asking about the prevalence. You said you have a special unit that is dedicated to handling this particular situation.
Yes, ma'am.
Okay.
So, come on.
Okay, it's pretty common. So, how is the diagnosis done? How do you diagnose? Is it done through blood test? And yeah, so how is it done?
Thank you, ma'am. The diagnosis is basically both clinical and radiological. The clinical symptomatology is what I have read out to you: the pain, swelling, crepitus, deformity, feeling of instability,
Mm-hmm.
and all that. However, for the clinician will take it up a notch higher by requesting for a radiograph of that knee. Radiograph meaning an X-ray of that knee, mm,
Okay.
which will show some features. You'll see
Mm-hmm.
that the joint space has reduced. You'll see some abnormal bone formations just around the joints.
Mm-hmm.
I might even see some deformity, glaring
Okay.
deformity on that knee on the radiograph. As a layman,
Okay.
you
Okay.
will be able to know.
Okay.
However, for the clinician, the orthopedic surgeons, there are some other signs, there are some other features on the X-rays that you
Mm-hmm.
see that will now change the diagnosis of uh, having osteoarthritis of
Okay.
the knee.
Okay.
However, also based on the what you are seeing on the radiograph too,
Mm-hmm.
and you merge it with your clinical symptomatology of this patient, will determine what you want to do.
Mm-hmm.
Mm. Be
Okay.
it initial adoption of a medical form of treatment
Mm-hmm.
before you finally say you want to surgically intervene when medical treatment has failed.
Okay. All right. So it's not done through because now the situation with the knee, we get to hear of a lot of massaging happening. Now a lot of people do this self-care thing at home when it comes to the osteoarthritis. We hear beyond the tying. I see the situation with So now it is only done at the hospital with X-rays, right? And by an orthopedic surgeon, not by a traditional medical practitioner. Okay. Now let's talk about how does it compare to the prevalence in the country? How does it compare to other countries? How, do we have it more as a black race, or it's more common? Do race matter when it comes to how common it is?
Well, race does not matter when it comes to the issue of osteoarthritis. However, we should also note that for us generally, we tend not to seek care, medical care, not until we are so pushed to the wall around this uh, area of the world compared
Okay.
to other parts of the world.
Mm-hmm.
Hence, most times we are not detecting them, and if perhaps you are detecting them, it will usually at a late stage.
Mm-hmm. Mm-hmm. Okay. So what are some of the challenges that you get to encounter in your practice when it comes to taking care of this condition?
Yes. Okay. Yes. Like I said before, most times they will usually present late.
Mm-hmm.
They would have gone to done home remedies,
Mm-hmm.
that is, gone to traditional bone setters in the hope that it will relieve their symptoms. The traditional bone setter does not understand the pathology.
Okay.
However, it feels, well, there is swelling, let me tie it up. There is pain, hoping that if I immobilize it, there will be relief. However, some would even go as far as giving scarification mark that will not even worsen the condition. Scarification in Yoruba, they will say, singere,
Okay.
with the hope that there will be cure. And once they give the scarification mark, they will add some of their other concussions and all that.
Mm-hmm.
That would even inflame the joint and even cause septic arthritis and worsen the condition of the patient.
Mm.
So, in fact, it is not advisable, and we are pleading,
Mm. Mm.
members of the public,
Yeah.
they are having osteoarthritis, just come to the hospital
Okay.
where you can have the appropriate care.
Okay. So what is the long term implication of not properly managing it? What is the worst case scenario?
Well, worst case scenario would be chronic persistent pain that will now affect your activity of daily living. Your activity of daily, you cannot virtually do anything. You will just be immobile,
Okay.
and you might be just in house. You cannot even be ambulant.
Mm-hmm. So it doesn't lead to other issues like it doesn't connect to other issues like
For somebody that is community ambulant prior to having this condition,
mm-hmm.
it can lead to depression. Depression can lead to other things, and even attempt at committing suicide on
Mm.
account of the fact that you that are actually ambulance, you are moving about
Yeah.
normally. You don't need anybody. You don't need any other care.
Mm-hmm.
Now, even to have access self care is now becoming an issue for you.
Mm.
You
So
cannot
I'm going
terminate
to ask
in
you.
such.
Okay, because another reason people don't get to go to the hospital much is because of the accessibility. So, how accessible are orthopedic care in the country, or how accessible is orthopedic care in the country?
Orthopedic care is very, very much accessible. Even within Lagos, Lagos has almost 35 general hospitals. And I can tell you, we have orthopedic surgeons manning all those general hospitals in at least, I think, three-quarter of
Okay.
those general hospitals. Yes,
Mm-hmm.
you might not be able to get orthopedic surgeons in the primary health care. However, in the general hospitals, there are orthopedic surgeons. Same
Mm-hmm.
for the teaching hospitals.
Mm-hmm. Okay.
And there are some too undergoing training to become specialists
A
in
specialist.
orthopedic surgery.
But the situation with the teaching hospitals and the general hospitals, some have pointed out, is that when you go to a particular doctor, even if you get to see the doctor, there's the issue with delayed appointment. They can give you 3 months appointment, and if it's an emergency situation, you can't possibly wait for 3 months. And even if you come back in 3 months, you're likely not going to meet the same consultant or the same orthopedic surgeon that diagnosed you, or your file might be missing. So are these do you agree that that makes it unaccessible?
Peculiar to orthopedic surgery itself. You
Okay.
know the rate of Japan that has occurred in the health sector,
Yeah.
be it the nursing as well as the doctors too.
Okay.
So it's not peculiar to the orthopedic
The orthopedic.
surgery
Yeah.
department
Okay.
or the orthopedic surgeon itself.
Okay.
However, there are also uh, orthopedic surgeons that do private consultations and all that in private hospitals. Mm.
Mm-hmm.
But in as much in lawsuits, most times you do not get to have such long appointment before being seen. Lawsuit post of almost 10 orthopedic surgeons. Mm.
Okay.
So there is no room for you to say you will not be seen. Yes, it might take long, but not up to a month before you are being seen.
But
And
I've seen it happen. Yeah, I've seen it happen firsthand. Where you go for emergency cases, and next thing is your case is delayed. Let's say you go today, which is the 28th of November, and then you're given 10th of January to come back. And so what do you think can be done in that regard? Because you are in the circle, you're in the practice. Why do you think? Yeah.
Of a managerial issue. However, with the advent of newer innovations, such as using what's it called now? You computerize your whole system, or you digitalize your system. Even not only seeing patients, also give an appointment to patients too. I think that would be an attempt to trying to resolve this issue. You do not need to have a manual or written record. Once you digitalize your system, irrespective of whoever is seeing you, you can see your past records and also can continue care from that part.
So is that something that the Lagos Teaching Hospital is already looking into? Are you aware of?
I'm not the management, but however, I have it on
I
books.
believe that. I believe that you guys also would have made such demands. I believe
Yes,
you have
I
an
have it on books authority that attempts are being made. However, in some general hospitals, that's what they do.
Okay.
They digitalize their system.
Okay. So how expensive is the osteoarthritis care? How expensive is it?
Yes, osteoarthritis care
it's not budget friendly, obviously.
is pretty expensive, especially the surgical intervention part. However, like I said, there are other options.
Okay.
Prior to giving it the big stick, which is the total knee replacement. Osteoarthritis of the knee, let me just put it hypothetically.
Okay.
It's like as if you have a tire that is worn out, and you are running your car on the wheels. That is the typical presentation of osteoarthritis to a layman.
Okay.
And also, it's as if you have a leaking roof of a house. You can patch until it finally gives way. You might ultimately need to change that roof. So, you might ultimately also need to change the knee. And that is where we call it the total knee replacement.
Okay.
Total knee replacement is pretty expensive. It comes in millions, depending on what implant you want to do. The knee replacement basically means the end of the bones, the shin bone as well as the thigh bone. You are replacing them and putting metal in there.
And that's surgically done in Nigeria. So we have surgeons that handle those cases in Nigeria.
Definitely, we do.
Okay. So I asked about the long term of mismanagement because I wanted to understand if this leads to paralysis. Does it lead to paralysis, or it's just pain that you feel eternally?
Well, it will lead to pain that is affecting your activity of daily living. And obviously, since you are immobile, you'll be immobile, you won't be able to move about and all that.
Okay.
Members of the club might call it paralysis. But paralysis has to do with more of a neurological issue.
Okay, it's more neurological. Okay, now let's talk about, now we've talked about the symptoms and how it's diagnosed. How about prevention and management? Is it something that is treatable? Okay, you said the surgery. So is the surgery 100% what's the word? Does it rectify it back to its normal state 100%?
Well, okay. Well, the essence of surgery, even before you go ahead and surgery, after discussing and liaising with your patient, you need to understand what does the patient want. It is what the patient wants that you would want to work with.
Okay.
Does the patient want only to relieve his pain? Does the patient want his deformity to be corrected? And you don't just go with your biggest gun. You should have been seen to have done other management plans.
Okay.
The medical management would include use of analgesics, pain relief, lifestyle modification for somebody that is obese. Okay. It is actually a multidisciplinary approach. It is not only the orthopedic surgeon that manages osteoarthritis. You have the physiotherapist, the nurses, the dietitian. For those that are obese, you have to send them to the dietitian. You tell them, try to lose weight and all that. Physiotherapy to help us improve the range of motion on that knee, muscle strengthening exercises, and all that.
Okay.
Then you can now adopt pain relief method. You give pain analgesics. Some will say analgesics work, but after the effect has worn out, they feel the pain. And afterwards, later on, they just say the analgesic does not even work, irrespective of they are given or not. Other options will also include what they call viscose supplementation. You tend to give hyaluronic acid. It's like a form of the grease of that joint.
Okay.
It will also help in greasing the joint to help prevent that contact between the two ends of the shin bone and the thigh bone.
Okay.
And that will also help improve the pain. Those are all temporary fix. When all this does not work, that is when we now push for a total knee.
Okay, so are there alternative treatments for the lower middle class when it comes to treatment of osteoarthritis? Are there alternative treatments, or it has to be one-way treatment?
Well, like I said, I've given all the options. However, it is ultimately, if all this does not work and patient symptoms still persist, that is when we now push for a total knee replacement surgery.
Okay.
Which patient will be adequately cancelled for. It comes in millions. It is expensive. I'm not aware of any foundation for now that is willing to, help reduce the cost or perhaps even sponsor. Though I know in National Orthopedic Hospital in Dala, there are some kind of incentives given to help reduce the cost. However, we are now pleading on philanthropists
to come in
who understands this. If they can help the members of the public, help us reduce the cost, because the implant itself is expensive. The implants are not made in Nigeria; they are brought from abroad.
So
and
what
will be beneficial for our members of the public.
What is the role of health insurance? How do you think things should be adjusted to accommodate issues like this in terms of health insurance in the country?
Yes, for insurance, orthopedic surgery itself is really peculiar because of the cost of most of our surgeries, and the cost of the surgeries is related also to the implant itself. Okay. And the implants are not actually made in Nigeria. The implants are the metals that we use in fixing up bones or changing the joint.
Okay.
Case in point, the total knee replacement. So it is expensive, and most times, most of the insurance or HMOs tend not want to really agree as regards trying to fund surgery, 5 million naira. Now, not to talk of the surgery fee and one or two things that you need in preparing the patient for surgery.
Okay. All right, now, so let's talk a bit about, I know you talked about it earlier on, the case of children coming out with the bow leg. I know the medical term, you talked about it. But now most of these children over time need correctional surgery to straighten it. So, what causes that during pregnancy, and what causes that for the child, and how is it to be prevented?
The commonest cause of deformity that we know around our environment in Nigeria is usually the rickets. Rickets is a result of calcium not being gotten by the children, especially those that are being weaned of children less than 6 and more than 6 months that are being weaned off breast milk, not getting the appropriate diet that will have calcium in them for them to, develop strong bones to prevent such. This is also peculiar, especially in the north too, where we have the women that wear powder that will prevent sun rays from,
Prevention
getting
of
to
sun can
the
cause that.
child. That will also help in, metabolism of calcium. Down south here, especially in Lagos, we have Blount disease. Blount disease is the etiology is not known. But however, you see patient comes down with the bull leg. Other causes could be post-infectious from septic arthritis, can be for trauma. If you have a growth plate injury around the knee, too, patient might possibly come down with deformity on that knee.
Okay. So, what are some common myths and misconceptions about these diseases? That's osteoarthritis and the situation with children where they come out with the club foot or the bow legs, or whatever bone disease there is.
Okay, well, for clubfoot, that's another.
Oh, that's another
kettle of
case
fish.
entirely.
Entirely. Clubfoot basically means the child's leg is clubbed, like a golf.
Yeah, like the
Golf
shape of a golf stick.
stick.
Yeah.
Mhm. So the child leg is curved. That is usually from birth. Usually from birth. It is not the mother that caused it. It's not the father. However, it is actually a
deformity.
treatable one.
Okay.
As a matter of fact, in Lasuth, we have a clubfoot clinic every Tuesday where we do our thing, we manipulate and cast. It is expected that with serious manipulation and casting and giving instruction to the mother.
Okay, but the
The
thing now is
clubfoot.
that club foot. I know someone with the situation, both feet are clubbed. It's not even just one. But then they've tried to, I think they did the surgery to correct it, but then it clubbed back again. I think they've done it twice, but it keeps bending back. So what could be the cause of that?
Well, for clubfoot, the best management is to use the pulsating method, which involves serial manipulation and casting. Yes, there is the role of surgery in managing clubfoot. However, you still need to manipulate and cast, So many deformities there that you are correcting, not only in one sitting. It is serial manipulation and casting. And then subsequently, you might want to do a tenotomy or what they call elongation
You know,
of
you
the
have to
Achilles
break
tendon.
those big names. I might not really
Uh,
understand what you're
yes,
saying.
tenotomy meaning you just want to, cut
Yeah.
that part of the heel that is not making the leg, the foot, to stand on the ground. For any surgical procedure, you must define your goals. And for even clubfoot, you want to make sure that the foot is shoeable. The patient can stand on that foot.
On the foot, yeah.
The foot is shoeable. That means you can obviously wear shoes on it, and it is painless or pain-free.
Okay.
And those are the techniques. Those are the things that we try to do when trying to manipulate and cast.
All right. So I asked about some myths and misconceptions as regards these diseases or bone conditions. Yeah. What are common myths and misconceptions you'd like to correct?
Yes. For clubfoot, most feel it is the mother that caused it. No, clubfoot is not the mother that caused that. It is actually so many research. There is no one way. So many theories have been proposed. It is not somebody from my grandmother side or grandfather side that done this to my child. No. Then for key leg, bow leg, some would have that conception that it is the way the child is walking that caused it. No, it is not. Mm. It is always that there are some pathologies that have resulted in it. That is why the child is coming down with it. You need to bring the child to the hospital for proper assessment and care. Some will also believe that any bone condition can be done by the bone setters. In theory, in principle, any fracture or anything, any bone hypothetically fractures, it will heal. The question is, how do you want it to heal? Do you want it to heal with deformity? Do you want it to heal with some abnormal attitude of the leg? That is where we understand the science.
Okay.
We understand the science behind the managing of this kind of condition.
Okay. So now the thing is, traditional medicine is a very common practice, especially with bone diseases and situations like this. So what do you have to say about that? What sort of enlightenment would you want to give about that? Because I know that organizations like NAFDAC and the likes, they've come out to talk about how this practice is not properly regulated yet in the country. Even though I'm aware that we have a department in the Ministry for Traditional Medicine Regulation, I think under the Ministry of Health, there is a traditional part of it to oversee that, because that's where generally the masses would resort to because of accessibility of healthcare. But now, when it comes to bone, like I said, around I've seen people do the practice a lot. They rub all sorts of leaves and herbs and tie all sorts of things, and with incantations on the leg even. So now what do you have to say about that? How would you like to enlighten the public about that?
Well, traditional medicine has come to stay.
But it's not efficient.
At least in Lagos, I'm aware it's well regulated. However, they can also help in early detection of this kind of condition and
let me understand something, Dr. Aisudo. I wasn't actually expecting you to. Are you endorsing traditional care? Because, like I said, NAFDAC and Co, they've said it's not a safe practice because it can. I'm not a doctor, but then they are saying that these things are not properly measured. Some of these things you give to the patients to drink, they are not properly measured. And what the NAFDAC and other regulatory agencies have, even the health experts have said, is that it can actually harm the liver and other organs when you don't check these things.
Yeah, you are talking in terms of medicine, in terms of the upper convention. I'm saying, even in Lagos, there is a traditional medicine board comes to say, and they are even more important, especially in preventing maternal mortality and morbidity.
Okay.
Even in Lagos, they are well regulated, and that is a fact. And it is also a fact that we know that members of the public will tend to go to a traditional medicine. Guys, why? Because they feel their cost is cheaper, they are more closer to them.
But as regards bone diseases, do you advise this?
But as regards bone diseases, they do not understand the science. However, we can always collaborate by, enlightening them about early detection. As of yesterday, we still did the seminar presentation on early detection of clubfoot and prompt referral to the hospitals. We did for those in primary health care around Ikeja axis. These are the kind of orientation we need to adopt and sell to them.
Okay.
Once you detect these are the signs and symptoms. Please just refer to this hospital where you can get the appropriate.
So like you said, that has to do with a lot of awareness, because if the traditional doctor is trying to cash out, how is he going to refer the patient to the hospital? That's another thing. But Dr. Aisudo, what would be your final words as regards osteoarthritis? I don't know why I find it hard to actually pronounce. Should we just call it arthritis?
Just osteoarthritis.
Osteoarthritis,
osteoarthritis is a pandemic. It affects the activity of daily living of an individual, ultimately. And, of course, it will affect the economy of the patient. It is important that we understand the risk factors and to even, more importantly, try to prevent it than for it to occur. However, once it has occurred, it can be managed. Patient can return back to his or her daily lifestyle without inhibition.
Mm. But is it something that comes up again, like the situation with cancer? Is it something that comes up when it heals? You're likely to have it again um, in later older age.
Well, because you have multiple joints, you have
Yeah.
the knee joint. It's not only one joint. It might
Mm-hmm.
affect the other one. The propensity of it affecting the other joint is there. However, with even with your knee joint replacement, it's not a one fix that you continue to use till the end of life. No,
Okay.
you might still have to do a revision surgery because it is metal. It will wear off. It's
It will
metal
wear
is
off.
bone.
Yeah.
It will wear off, and you might possibly need to revisit after the arthroplasty has failed.
Mm. Okay. So you're
Usually around 15-20 years after the surgery.
okay. So prevention. What is the best way to? I know you did. You talk about prevention before, but more importantly, they say prevention is better than cure. So how do we prevent this?
Yes, I wrote out the risk factors. So basically,
Okay.
big risk factors.
Mm-hmm.
There are some you cannot modify your age, neither
Okay.
can you modify your sex. However, all those other modifiable risk factors,
Mm-hmm.
such as smoking,
Can be reduced.
alcoholism,
Too much clubbing
um,
too can cause it.
obesity, very important
Yeah.
for those that are overweight. Your
Mm-hmm.
knee is carrying so much
Yeah.
that it will now break down. It will wear and tear. Uh,
Mm-hmm.
if you can help us shed weight, that would be very important. Mm.
Yeah.
Help us lose weight in
Say
order
help
to
us
save
lose
the knee.
weight. All
Mm.
right then. Thank you so much, Dr. Isido. Thank you for your time with us. That was insightful. Have a very good day today. Why you do what you do. Admire you, doctors. All right then. So there you have it. Osteoarthritis. It talks about prevention and early detection. Detection. So now, over time, the health experts have reiterated that it's a collective effort when it comes to tackling health conditions that are prevalent in the country. Early detection is key. They would say you go to the hospital and don't jump on the bandwagon that would say, okay, fine, the hospital is not effective, and then you don't go and find out for yourself. So it's important we find these things out for ourselves and take better care of ourselves and make it a personal responsibility of yours to create awareness around these issues. Okay, there you have it on Spotlight. Tomorrow we'll be back. Hopefully, we'll see what pans out with the tax reforms bill at the Senate today that caused an uproar yesterday, and hopefully, we'll address that. So much going on in the country that affects everybody. All right, then stay tuned. The sports crew will take over shortly. I am Kimberly, and I am signing out at this point. Enjoy your day.